Knee injuries are quite common amongst grassroots footballers, and there are empirical evidence to actually back this up. In Nigeria as well, knee injuries are common amongst our grassroots footballers. Specifically, these knee injuries can take the form of a meniscus tear. So the meniscus is the shock absorber of the knee. It could, in some cases as well, we've seen cases where grassroots footballers suffered anterior cruciate ligament tears as well. So these are common injuries you would see amongst grassroots footballers in Nigeria. So what are the causes of these injuries? Some of the causes of the injuries is lack of proper warm-up, okay, and also lack of proper warm-up techniques. There is a warm-up protocol that is evidence-based, and the FIFA has also encouraged football teams to do that, called the FIFA 11 Plus. The FIFA 11 Plus is a kind of neuromuscular training program that helps footballers prevent lower limb injuries. And studies have shown that close to 40% of injuries, lower limb injuries, knee injuries as well, can be prevented using these warm-up modality. Other reasons for these knee injuries from the Nigerian perspective is sometimes direct contact with an opposing player. It could also be a player trying to control the ball or trying to land on the ground following an header, and the player twists his knee. So these are some of the causes of knee injuries that we see. What are some of the challenges in treating these knee injuries? One major challenge is late diagnosis and also wrong diagnosis. So by late diagnosis, so you see a player has got a knee pain, okay, or the knee is not stable, and they just keep managing it, do the do the basic first aid, and basically that's all. Okay, yeah, while basic first aids are good, but injury management shouldn't stop there. You should still investigate further to understand the cause of the knee pain, of the knee instability. So again, that is a one major issue. And sometimes some of these grassroots players, because of funds, they go to these local people, and there is always an issue of the local people just massaging their legs, just tending to the symptoms, okay, which is the pain, which is the swelling, but not dealing with the root cause of the pain or the swelling. So you see them, they take care of the swellings, and they go back to football, and the injury occurs again and again and again. Another big issue is the issue of funds. Okay, so by the time they see a sport doctor, so a sport doctor would first of all want to request for an MRI, and MRI in Nigeria at the moment costs about 100,000 naira. And I'm not sure, even when Nigeria was not this, even when this commission was not the way it is, see people struggle to even do an MRI around 70K some 4 or 5 years ago. So there's an issue of people not having funds, to even do an MRI. And even when they do an MRI and they require, maybe a rehabilitation, okay, or they require some more definite management like surgeries, they also don't have, funds to do that, okay, and that's why you see in recent times some of them go to social media to seek for funds. So again, those are key major things, challenges in managing injuries. Another issue is an issue of perception. Okay, so you see players get injured and they probably see it as, oh, well, it's nothing, and sometimes they say, no, why not go see a doctor? They oftentimes think that maybe the doctor will give them a kind of diagnosis that will not make them play again. So it's always an issue of being scared of what the doctor will say, or not even believing in the doctor's expertise. So they would rather not come to the doctor because they feel the doctor is just giving them bad news. Okay, so those are some of the major issues we have with it. What can be done? So first of all, we need to to provide loads of education. So that starts from education. So in medicine, we have 3 levels of care. So we've got the primary care, okay, the secondary care, the tertiary care. So the primary care is largely prevention, okay, and early diagnosis, okay. So we need to do a lot of uh, health promotion, but sports medicine related. So we need to do a lot of health promotion in terms of, okay, this is the right way to warm up. Okay, this is the right food to eat. This is the right water to take. Okay, uh, because these things are, are risk factors, for injuries. We need to let them know, okay, if you're having these symptoms, let's say you have a game and you have a knock, and you're having the symptoms, these are the things you need to do first, and these are the things you need to do, following that kind of pre-hospital care. So we need to begin to educate the players. We also need to educate the coaches and other support personnel. And in Nigeria, you find that these players, oftentimes from experience, they kind of even listen to their coaches more even than any other support personnel, and for many reasons. So we need to educate the coaches as well, let the coaches understand these preventive modalities. The coaches also must be trained in basic first aid. The coaches must know, okay, what a symptom of an ACL looks like, okay, so that they could signpost to the players, to the right people. Secondly, aside from education, we need to now begin to build capacity. Okay, a very big issue, okay, is that we really don't have, for example, medics that are kind of trained in managing sport injuries. I'm a doctor. My undergraduate medical degree did not teach me about how to manage sport injuries. I mean, I had to do a master's, got a few experiences here and there before I could, understand, how to manage sport injuries. So we need to begin to build capacity in terms of a medical curriculum, include 1-2 bit of sport injuries, how to diagnose it, etc. There, post-medical school, do CPD seminars, and not just doctors. We need to also bring other healthcare professionals on board. Okay, bring nurses, bring exercise physiologists, physiotherapists, even masseurs as well. Let everybody come and understand, what sports exercise medicine, what they need to do. So that's something I believe that we could do. Then we also need to look at the area of policies. Okay, we need to talk about how can we make sports medicine a kind of policy, a kind of, a guidance in that way, maybe not policy. So before you set up a grassroots club, we need to have, these are the things that needs to be there. So we need to have checklists before anybody can set up a grassroots football club. And part of the checklist should include that you have the provision for health care for your athletes. Okay, and this must be prerequisite. This must be a policy. This must be something that must be adhered to before anybody, can set up a club. Because you don't want to set up a club because you have talent all over and just bring this bunch together, you bring these girls together without any deliberate effort to take care of them in case they have injuries, or without any structure in place to also prevent these injuries from happening. So, these are just some of the things that I believe that we can actually do. Thank you.